Hi, I'm Kimberly Reyes from Pixels and Pills, and I'm here with Rishi Shah, the CEO and co-founder of ContextMedia. Rishi has been honored as one of Crain's top 40 under 40. He's also been honored by Business Week as one of their fresh entrepreneurs. So hi Rishi, how are you?
Nice to be with you today.
You just did a really great dynamic presentation on point-of-care media. Can you please tell us how you got the idea for your company, ContextMedia?
Sure. So, we've thought about context media for years now. The first time I was inspired to do something in the waiting room was when I was a kid, probably 7 or 8 years old. My father was an endocrinologist, a specialist treating diabetes. And I worked at his office rather, for a couple weeks in the summer. I was a copy boy, wanted to see what he was doing. And I saw, I was a sort of an ambitious copy boy, if you will, so we designed a little market research survey, and I passed it out to all of his patients. I asked them, what do you like the most about your office visit? What do you dislike the most about your office visit? How do you feel about it? And they all said, we love your dad. They probably knew that they had to say that because he was my dad. But they all said, we don't understand why we have to wait so long. It was the middle of the day. The waiting time was often half an hour, 45 minutes, and they said that was the worst thing about the entire office visit. So I thought, this isn't too bad. I went to his lead secretary at the time, and I said, why don't we just slide all the patients back half an hour? This seems simple. Of course, I was 8, and as she told me, you can't do that. All doctors' offices have a half-hour wait because they can get called into the hospital, so on and so forth. And I always thought it was funny that we waste that moment, even though I was young at the time. It was so obvious that these patients were nervous. They wanted to know more about their health. They clearly were hungry for information. They were open to it, and we did nothing with that time. There was an old Reader's Digest, maybe some brochures scattered around the office, but the time was sort of a black hole. Nobody was benefiting from it, and it was such a powerful setting. So I think I probably got the crayon set out and drew some posters, and we hung them up, and I forgot about it. I went off and I started a lot of other businesses and sold them, and then about 4 years ago I was at a media conference on digital out-of-home media, and you had a lot of cowboy entrepreneurs, Wall Street analysts, industry people that were talking about the power of the fourth screen, which we heard about during this conference. You had entrepreneurs putting screens up all sorts of places, stores, right? So Best Buy, a Walmart, trains, airports, elevators, and I was walking the exhibit, and I thought, wow, this technology would be incredible in an office just like my father's. So we started in 2006 deploying waiting room TV systems, media systems into chronic disease care offices. We started in diabetes because it was personal for me. I had family with it, and I knew a lot about it, and I wanted to make a difference there. And the response was amazing. So now we're in a quarter of all diabetes practices across all 50 states. We reach just under 1 million viewers each and every month for half an hour. And most physicians think of us as a part of the office visit. So you come to the office, you sit down, you watch the Diabetes Health Network about lifestyle, how to live a healthier life, and after that you go and see the doctor. So when the doctor says you need to lose weight, you need to eat healthier, they are armed with solutions to do that. They don't go back to the supermarket, shop the same way, eat the same way, live the same way, come back and hear the same story again.
That's amazing. That is such a great idea. So tell us, what do patients want at point of care?
Sure. So I think the biggest lesson I've learned is people are skeptical about patients. They think, especially in diabetes where you have chronic disease care, patients don't want to learn about eating healthier. They don't want to learn about fitness. That's why they got diabetes, right? Or so the myth is that they didn't exercise, they didn't eat healthy, and they're going to continue to be on that trajectory. The fact is that a quarter of all endocrinologists across the U.S. are in our network, and we hear from them all the time that patients love the recipes, they love the healthy lifestyle tips that are on our network. And it's not business as usual. They are going in and asking for those recipes. They're having conversations about them with their doctor. They're shopping differently. They're eating differently. They're living differently. So when we arm them with lifestyle information during the office visit, when they're most interested in change, when they hear from their doctor that they need to make this kind of lifestyle change, and we give them ways to do it, they are taking it. So I guess the number one lesson has been lifestyle information is first. They want to learn about nutrition, they want to learn about fitness, and the other secondary thing they really want to learn about is treatment and medication. So they're curious, in our case, about insulin pumps. They're curious about the newest and latest blood glucose meters. They're curious about moving to an insulin pen. They're curious about new therapies. So they're thinking about their care. They're searching for solutions. So we almost reach them in a search advertising way.
So you and I were both there when Howard Dean gave his presentation the first day and talked about his he gave a doctor's perspective on the patient pull and DTC. And so you in your presentation addressed the same issue. So how are you sort of getting the doctor involved in the content that you play through Context Media?
So Governor Dean was a physician for 10 years in Vermont. And I think he's right when he says that physicians are frustrated by some of the patient pull that you see. And my view is it is a problem. I think he's right about that. Physicians, as I mentioned during my presentation, are not going to be disintermediated from patient care. They're not going the way of the travel agent in travel. We will need them now. We need them now, and we will still need them 10 years from now and 50 years from now. That's not going to change. So I think Dr. Dean is right that you can't do patient education in a vacuum. You can't do it out of the patient-physician relationship. You have to honor that. You have to respect it. It's not just physicians that are frustrated. I think patients are frustrated too. So the way we approach it is we work with the physician and the patient in the office setting, and we ask them what they want to learn. We don't dictate it. We view media increasingly as a service and not a product. So we are a facilitator. We talk to doctors, we ask them what content they want to show their patients, and we facilitate it. We source it, we procure it, we run the hardware, we run the software, and then we help them display it. But it's their network, they have control of it. They can reject and remove any content segment, any commercial message, and because of that, patients view it as much more credible content, and in the end we all win. So pharma wants to advertise on credible mediums that patients and physicians like. So I think point of care is a great example of that.
And finally, are there any words you want to leave us with on this, which is day 3 of DTC, the final day?
Yes, I think my perspective on it is change often comes in incremental ways. So we've talked for years now about social media. I remember coming to this when search was still very much up in the air, and we're now doing some of those things. But my advice and recommendation to the community would be think about how the technology and the future we're talking about can be implemented in the next year. And in many cases at point of care, we're able to do that. So it's easy enough to say, let's blame the FDA. They haven't given us guidelines, and so we're paralyzed. But the truth of the matter is there are things we can do right now. And I know of many examples at the point of care, but it's in the interactive space, it's in many other spaces, ways that we can leverage this technology in this year's media plan, in next year's media plan, and not be paralyzed, although I know it's frustrating at times, by pending guidelines and what the future will bring, because we don't know.
Thank you so much for speaking with us. Thanks. And this is Kimberly from Pixels and Pills, signing off from DTC.